Now, the final part of this chapter we'll go into is when we'll talk about a little bit about physicians and some of their behaviors that aren't always about the patient, but more about kind of the money, the business aspect of it. So, if you've ever been to a doctor and that doctor you've had an issue and the doctor said, all right, well, you need to go see the specialist. Here's the great guy. I refer you to him or her. Well, you might be thinking, well, why? Why would they be doing that? And the basic idea is that what happens a lot of these times is there's kind of a network within doctors, and they will refer people to that doctor, vice versa. Maybe some side dealings in there. And this becomes especially the case when you talk about insurance companies, because insurance companies will a lot of times let me rephrase, not a lot of times, but they could have the incentive to pressure the doctor to send it doctor to certain other doctors so that they may have a better deal with, and that may be in part of the managed care agreement that there's a network that doctor is to choose from. Another practice is price discrimination. And if you remember price discrimination is when one person pays more for a good or service than another. Right? And so student discounts are an example. If you go to the movies, students will pay less than non-students. Okay. What price discrimination all comes down to is willingness to pay. The more people are willing to pay, the more they tend to get charged. This happens in the medical field as well. Now, what ends up happening is richer patients tend to pay more than poorer patients. Patients who are upper income tend to pay more for healthcare than people who are lower income. Okay. So the thing you might be thinking is, well, wait a second, what happens? You walk in there, they see you wearing a nice tie, and so they're saying, oh, you know what? We're going to charge him a little more. No, it's not the way it works. It really doesn't come down to your money, but it comes down to more what your money gives you. What I mean by that is that people who are higher income tend to be in that position because they have better jobs. And if they have better jobs, better paying jobs, they tend to have better insurance. And with better insurance, it tends to pay more. Okay? So these are all things that lead to it. Whereas people who are low income tend to not have as good a job, if any job, and they tend to have not great insurance, if any insurance. Right? Now, a couple other points with that. So when it comes to discrimination, the disparity can really depend on elastic versus inelastic. And so elastic is when you have a lot of the patients are very sensitive to price changes. And so with them, you want to bring down the price, because because people are sensitive, you're going to bring out a lot more demand for it. Whereas with less elasticity, you want to charge them more. Because if it's not very elastic, more inelastic, you can raise the price without losing that much demand. Now, a big part of where a lot of this discrimination comes in is with insurance. And so here we have two lines. We have demand for healthcare with patients with insurance and without. All right, and this is assuming that these are the exact same patients. So you might be thinking, well, wait a second, why would they act any differently? Because with insurance, as we talked about, they're not paying that full price. They're only paying the copay and or the deductible. And so because of that, this P1 here, well, that's still maybe the amount. So basically P2 and P1, with this specific example, In both those cases, the patient is paying the same amount out of pocket. Where the difference between these is the insurance company is going to kick in the rest when the patient has insurance. So what happens then is, with price discrimination, the idea of richer patients paying more than poorer patients, what's going to happen then is that the people with the insurance, the hospitals are going to charge them more. The doctors are going to charge them more because they know that they, with their insurance, the insurance is going to cover a lot of it, so they can charge them more and still get money. Whereas patients without insurance, they can't afford a lot of times those big bills. And so they have to charge them less if they're going to get paid for it. So this is an issue. Another type of price discrimination is with types of services. So there are some services that a patient get where they would get overcharged, whereas others they may get undercharged. And where you tend to see the most overcharging is for the very, very high cost procedures. So for example, a transplant, kidney transplant. You're going to see more overcharging there, and the reason for that is because with those high cost ones, if they're being told that they're going to pay for it, the insurance, well, okay, the hospital says, all right, good, we'll charge a nice high price for that. And the reason why they can do that and why the insurance company doesn't push back is because the insurance company says, all right, fine, you do that, and then it just gets passed on down to the patients. Okay. So now, the other thing to note here is the idea of price discrimination is that what happens because of insurance? Your insurance ends up paying for people, at least some of the costs of people who don't have insurance. The hospital needs to make up that cost. And so with price discrimination, what tends to happen is that the people who have money, who have insurance, they're overcharged, and part of that overcharging is because the hospitals and doctor's office may be taking a loss on the patients without or not making as much. So we talked a little bit about the difference between fair premium and actual premium, costs versus charges, and part of that gap is in this price discrimination. It's in the fact that you're paying by your premiums for people who don't have insurance, because that money still needs to get to the hospital somehow, and this is the way. Something else when it comes to doctor practices, doctor behavior, is practice variations. Now, a lot of times you would think that, okay, if I go in to see a doctor, I'm going to do the same. I'm going to get the same course of treatment, regardless of where I go. But what happens, however, is not the case. So these are variations in age-adjusted rates of hospitalization for different diagnoses. So basically, it's number of hospitalizations in person years. So you would expect, if all hospitals were treated the same and each dot represents a hospital, you would expect them to be more like over here. But in reality, you see a lot of hospitals where some hospitals are much more likely to admit you than others. So where you go, you're not necessarily going to get the same treatment. Now, a lot of this comes down to the idea of insurance, price competition, the structure. And as has been discussed a lot, the structure of the medical market financially is drastically different than pretty much everything else out there. Physicians don't advertise prices, they don't offer discounts, and because the supply and demand is relatively speaking high, there should be a lot of competition, but there's not. And part of the reason why is that we have insurance. We're not fully seeing the prices. We're not fully aware of it. Okay? So hospitals don't really have to compete with us, the patients. They have to compete more with the insurance companies. So that definitely is a big issue and something to be concerned about.